Thank God I live so close to work. Okay, so one of my patients today will require keratometry, and I guess I just need a refresher.
What's up YouTube? Welcome back to our channel Orthoptics 101. This time we will be reviewing the manual keratometer.
Keratometry is a method used to measure the power of the cornea. Measuring this will give us the refracting power of the cornea, which can help in the diagnosis of astigmatisms without subjective refraction. When we use the manual keratometer, you are looking at the curvature of the cornea in real time to see where it is steepest or flattest, the refractive power, and the integrity of the cornea and tear film. A common reading will be between 43 and 44 diopters of refracting power. Here are some situations in which keratometry is useful. It is important when fitting contact lenses because it determines the overall shape of the cornea, which will determine the correct fit. It allows for localization of the cause of the refractive error to the cornea or a posterior structure such as the lens. By assessing the power of the cornea, it gives information on possible intraocular lenses that would be used for cataract surgery. It also evaluates distortions of the cornea such as keratoconus, corneal scarring, or post-surgical procedures.
Here we have our lovely manual keratometer machine. Here is the horizontal drum in order to find the primary meridian. It can be adjusted forwards and backwards until the plus signs are aligned. Moving on, we have the vertical drum. Here we do the same thing in order to get the minus signs aligned and superimposed. Here we have the rotating drum, which is used when oblique astigmatism is present. Lovely touch up, just to ensure the 90-degree axis is aligned with that vertical meridian. Here is the focusing piece, and this can be adjusted to your refractive error if need be. Moving on is the joystick to move the keratometer forwards and backwards in order to get the eyes focused. We do have a locking screw in order to keep the keratometer stable. Here is the swivel knob in order to increase and decrease the height of the keratometer. Here is the on and off switch, as indicated by the illumination. Following on is the chin rest. This can be adjusted just so the patient can sit comfortably and have their eyes adjusted to that line. Following is an occluder, just so we can measure each eye individually and with precision. Exquisite pan. Here we are with the up and down button, which increases and decreases the height of the table. If you have a tall patient, increase the height. If you have a shorter patient, decrease the height. When looking through the keratometer, you should be able to see the eyes. When out of focus, you will see a double eye as shown. In order to focus the eyes, adjust the position of the keratometer forwards and backwards using the joystick until the double circle becomes a single circle and in sharp focus. In order to measure the corneal curvature, we must find the primary meridian first. The primary meridian is defined as the meridian closest to 180 degrees as measured by the plus signs of the my image. If needed, adjust the keratometer forwards and backwards until the plus signs are in focus. Once in focus, ensure that the plus signs are continuous with each other. If they are not already, rotate the barrel of the keratometer until they are aligned. From here, rotate the horizontal handle so that the plus signs coincide and the vertical lines of the plus signs are superimposed. From here, we have found the primary meridian and now must find the secondary meridian. The secondary meridian is defined as the meridian closest to 90 degrees, as measured by the minus signs of the my image. As mentioned with the primary meridian, if needed, adjust the keratometer forwards and backwards until the minus signs are in focus. From here, rotate the vertical handle so that the minus signs coincide and are superimposed.
When you record, you are noting the power of the meridian, both vertical and horizontal, and not the axis like in subjective refraction. We record powers in two readings, K1 and K2. K1 is the flattest curvature or the smallest power, and K2 is the steepest curvature or the larger power. Once you have both K1 and K2 recordings in both eyes, you will need to find the difference between these powers, and this will be the amount of astigmatism the patient has. You will also need to note what type of astigmatism is present, either with the rule or against the rule. With the rule astigmatism is common in children and younger eyes, compared to against the rule astigmatism, which is commonly found in elderly patients. You can see in the against the rule example here that the flattest meridian is in the vertical plane with the reading of 42.25 diopters at 90 degrees. There are multiple classifications of astigmatisms, and we'll go through them now. Firstly, there is simple astigmatism, and this is where one of the meridians will refract the light onto the retina and the other meridian will fall in front or behind the retina. This is referred to as simple myopic astigmatism or simple hypermetropic astigmatism respectively. Compound astigmatism is where both meridians do not fall on the retina and both fall either before or after the retina. You will need a combination of spherical lenses to shift one meridian onto the retina and then use an appropriate cylinder lens to correct. Mixed astigmatism is similar to compound, although one focal line falls before the retina and the other behind. You will need to take the same approach as compound astigmatism to best correct this type. Irregular astigmatism is when the meridians are not at right angles to each other, and oblique astigmatism is when the meridians are at 45 degrees and 135 degrees. The pros of performing manual keratometry is that it is a fast, painless procedure that does not require dilation of the patient. It provides clear understanding of the pre-corneal tear film integrity, gives a dynamic view of the anterior surface of the cornea, and it is preferred to use manual keratometry in patients who have poor fixation, corneal abnormalities, or corneal dryness. Some bonus tips and tricks with keratometry are to perform the test before any eye drops are instilled or any cornea applanation tests are performed. These activities can change the curvature of the cornea and may interfere with the result. The best results are found when the patients are not currently wearing contacts and have not worn contacts in the past 5 to 7 days. Ensure that you have calibrated the keratometer before the use and the eyepiece is focused specifically for the operator. If you get results less than 40 diopters or higher than 47 diopters, it is best to recheck the patient as these results are uncommon.
Alright, that's all for this video. Thank you for watching and don't forget to like, subscribe and hit the notification button down below. See you next week.
Oh, that's alright. So my first patient today is Daniel Tan at 12 PM. He's got keratoconus and we'll just go get him now. Daniel Tan? Daniel Tan? Daniel Tan.
Yes, I'm here. Hello.
Please come in.
Thank you.
Have a seat.
Thank you.
Okay, Daniel, can I get you to confirm your date of birth and address?
6th of the 9th, 1969, and the address is 35 Ligonier Street in Box Hill.
Okay, that's right. Make sure you have the right patient. Okay. And I see from your referral that you've come in for keratoconus.
That's right.
We'll just test you using the keratometer, that machine there.
That one there?
Yep.
Okay.
Let's get you to sit on this side. Oh, no, just sit back for now. On the chair.
Okay.
Make sure you set up the patient in the machine first. Okay, I'll just clean the chin and forehead rest first.
Thank you.
Please take off your glasses. And chin and forehead up against the two breasts. So I'll be testing your left eye, and I'll just occlude your right eye. And I'll need to shine this light through, so if I could just get you to close your left eye. Okay, you can open it again. Come back to the desk and I'll explain the results to you. Okay, Daniel, I have your results here. I'm just going to pass these on to the ophthalmologist.
Okay.
That's all for today. I'll just walk you out and we'll get you back in a couple of days.
Okay, great.
Thanks.
Thank you.
So I have a few meetings to go to now. I might see a couple of patients during the day. Oh, thanks for today. My last few patients didn't agree to be filmed, and that's all. Remember to like and subscribe.